What's going on, guys? Dr. Jabal, MedschoolInsiders.com. I'm out here in beautiful Taipei, Taiwan. This is my first time in Asia proper, and if you want to see what I'm up to, hit me up on Instagram at KevinJabalMD. Now, speaking of Instagram, you may know Dr. Daniel Choi. He is an attending spine surgeon in New York. Now, he and I were having a great conversation about the whole Save Our Doctors, physician well-being, things like that on Instagram, and it was so good, and he has this unique perspective as an attending physician that I wanted him to share it with you guys. So without further ado, here is Dr. Daniel Choi.
Hey guys, so my name is Dr. Daniel Choi. I'm an orthopedic spine surgeon at Long Island Spine Specialist, PC, here in Long Island, New York. I completed my undergraduate degree in psychology at Northwestern University, which was a 4-year degree. Then I subsequently went to med school at Northwestern again, and that was 4 years as well. And then orthopedic surgery residency was done at Rutgers in Newark, New Jersey, which was a 5-year program. And then my last year of training was at Beth Israel Deaconess at Harvard Med School. And that was a 1-year program. When you're a resident, you are basically working under the guise of your attending. And so your patient did not come to see you, Dr. Choi, the resident, they came to see your attending. And so any difficulty that you might run into in their care, which happens, there's treatment decisions that are difficult or complications that occur during surgery. As a resident, you have that attending to basically back you up. But when you're attending, all of that falls on you, and obviously it should. Your patients are coming to see you, and so any difficulties in the treatment algorithm, or even when you're in surgery and you're not going from point A to point B in a surgery very quickly, sometimes there's curves and twists, and the patient has scar tissue, or the case is not going the way you predicted. Well, basically you have to figure it out as the attending, and so I do think that responsibility weighs heavily on you as a brand new attending. For medical students and residents, I think that the biggest overlying cause of burnout would probably have to be bullying, and bullying by a student that's older than you or a resident that's older than you usually. Medicine is this hierarchical culture where you're kind of working to the top, and so you're always going to have someone above you with more experience. And I've witnessed it firsthand, even experienced it, where there can be bullying and make students and residents feel terrible, and you just don't feel like it's a safe place to learn. And so I know there was a viral post by Humans of New York on Instagram recently by a medical student who basically stated that his attending told him, I'm gonna be an a-hole to you on purpose. And so I think that's completely inappropriate and leads to this potential burnout for students and residents. So I think that the biggest contributor to attending burnout, and I'm really going to comment more on surgeon burnout, I think, is medical malpractice and the climate in which we practice, where surgeons are really afraid of being sued all the time because they hear stories about it. And I know several surgeons who've been sued, and the look on their face when they describe the whole experience of being sued. And these are good surgeons who are, they have great reputations in the community. They're really out there to try to help their patients, and there's a frivolous lawsuit and it goes to trial. And I can tell you that they tell me personally that was the worst feeling and the worst experience of their lives. And so I really think that if a surgeon is practicing to avoid lawsuits, it's a terrible way to practice. You should be making decisions that are in the best interest of your patients. But if you're sitting there thinking about, oh my gosh, I might get sued, and I should take the safe route instead of what is right for the patient, that's really a terrible way to practice medicine. And I think it really contributes to physician burnout. So the first thing that all of you guys can do to really fix this issue of physician burnout and the higher risk of suicide that physicians are in is to really raise awareness first. So to discuss this on our social media platforms, to discuss it amongst our colleagues. The statistics that are insane, I think, that physicians are at such an increased risk of suicide than our colleagues in other fields, banking, finance, whatever else, they don't have similar rates. And so I think that at least letting people know that this is going on is the first step. And I think the second step is taking tangible steps to really rectify, the toxic workplace culture that sometimes exists through bullying in our med schools, in our hospitals. First of all, we ourselves have to stop participating in it if we're guilty of bullying. And then secondly, really raising awareness in the workplace and taking steps to try to fix that culture and make sure that culture is not accepted and tolerated in your workplace. I'm going to be part of the judge panel for the Save Our Doctors campaign by Dr. Kevin Jubal, and I think this is an awesome campaign to raise awareness and to try to fix this situation. So if you're a student that's going through bullying right now and you're having a terrible experience on your rotation, I feel badly and I'm sorry that you're going through that. It's a tough situation because as a student and as a resident, you're constantly being evaluated by someone above you or with more experience, and they may be participating in that bullying. So it's a tough situation. Usually in your medicine team or whatever team you're working in, there's always going to be another senior resident or even the attending of the rotation. If you trust them and they're not participating in the bullying, it may be a good solution to maybe discuss the scenario with one of them. If there's nobody that you really can trust on that team, which can happen, then maybe going to the clerkship director or whoever's organizing the education for that rotation is the best person to turn to. So guys, if you guys want to learn more about increased rates of suicide amongst physicians and physician burnout, you can check out the Save Our Doctors website, which is linked in the video description below. Also, I'm pretty active on social media, so you can find me on Instagram at SpineDocNY. I also have a YouTube channel as well. Thank you guys for listening to this video, and I'll see you around.
Thank you, Dr. Choi, for sharing your knowledge. Much appreciated. Again, if you guys want to follow him, I'm going to have a link to his Instagram and YouTube channel down in the description. Now, this is a new format for me, so let me know what you guys think down in the description below. As always, thank you all so much for watching, and I will see you guys in that next one.